The purpose of this segment, or this particular video, is to give you some understanding of what I call the slope. Every ALS patient seems to have their own speed of symptom progression. Some people have a very shallow slope, so the progression of symptoms from onset or from diagnosis until the end seem to be very, very shallow. Some people seem to experience a very, very steep slope, and therefore their life expectancy, unfortunately, is much shorter. My wife had bulbar onset ALS, which meant that it started in her throat. According to all of the literature, bulbar ALS, the normal or the average time frame for bulbar ALS is 2 to 3 years. My wife's was 2.5 years, directly in the middle of that 2 to 3 year time frame. My experience as a caregiver was probably maybe a little bit different than yours, in the sense that she was mobile, or at least reasonably mobile, until the final 3 or 4 months of her life. So I didn't have to deal with a wheelchair situation, which many of you will experience, especially if your PALS contracts ALS starting in the legs. One of the things that's unique about ALS is, or at least it appears that way from everything I've read and from what the doctors say, is whatever slope you're on, you stay on that slope from the beginning to the end. The progression doesn't increase or doesn't decrease. With some other neuromuscular disease, there may be some increase in symptoms and then a leveling off for some period, and then the symptoms start up again. That doesn't seem to be the case with ALS. With ALS, whatever that slope is, whatever that degree or speed of progression is of your symptoms, that's what that patient is going to be on, or that PALS is going to be on, from the beginning until the end of their ALS experience.